Focused History of the Limping Child by Large Academy, written by the academic director of Large Academy. Starting the consultation. Wash, sanitize your hands and use personal protective equipment if appropriate. Start by introducing yourself to the patient and their parent or guardian, including your professional name, grade, role, purpose, and nature of the consultation, i.e., history taking, which is like a friendly interview, and how it would last approximately 5 minutes. Then confirm the patient's name and date of birth and proceed to gain consent for taking a history. Presenting complaint. Confirm the limping and for how long. Unilateral or bilateral. History of presenting complaint. Socrates will apply here as well. Start with site. Ask about the location of the limping, then move to onset. Clarify when it first started and if the onset was sudden or gradual, and clarify character. Ask about the specific characteristics of the limping and a certain radiation. Ask if the limping moves anywhere else and ask about associated symptoms. Ask if there are any other associated symptoms and define time course. Ask how the limping has changed over time and note exacerbating or relieving factors. Ask if anything makes the limping worse or better and establish severity. Ask how severe the limping is as on a scale of 0 to 10. Screen for other key symptoms, including red flag features and psychodevelopmental impact. Explore the patient's ideas, concerns and expectations and summarize the patient's presenting complaint and confirm it's correct. Systematic review. As appropriate, screen for relevant symptoms in other body systems from head to toe, especially prior fever, constitutional symptoms, pregnancy, childhood, and developmental history. Ask for the relevant history as appropriate. Past medical and surgical history. Ask for falls, osteomyelitis, non-accidental injury, history of congenital dislocation of the hip etc. Drugs history, analgesics etc. Family history of childhood limping, sickle cell anemia, thalassemia etc. Social history. Explore the patient's general social context by asking specifically about sorrow, which translates into smoking and alcohol history, recreational drugs, and occupational and travel history. Prepare for the examiners. Quickly write a summary of the history in your head and think of diagnosis, 3 to 5 differential diagnoses from the most possible to the least probable. Also, think of examinations that would support your history, investigations and treatment algorithm from simple to complex, following the latest guidelines. Thanks for listening. Don't forget to subscribe to Large Academy on YouTube and other social media platforms.